Autoantibodies. Thyroid-related antibodies. Thyroid-related antibodies include 1. Anti-thyroid peroxidase antibodies, anti-TPO. 2. Anti-thyroglobulin antibodies. Both are elevated in Hashimoto's thyroiditis. 3. TSH receptor antibodies, elevated in Graves' disease. Anti-nuclear antibodies. They are elevated in systemic lupus erythematosus, systemic sclerosis, Sjogren syndrome, dermatomyositis polymyositis, mixed connective tissue disorder, autoimmune hepatitis, rheumatoid arthritis, autoimmune thyroid diseases, malignancy, infectious diseases, systemic lupus erythematosus SLA. Antibodies elevated in SLA are anti-nuclear antibodies, which is not specific. Anti-dsDNA antibodies is specific. Anti-SM anti-Smith antibody indicates renal involvement in SLA. Anti-LA antibody anti-SSB in 20–60% cases. Anti-Rho antibody anti-SSA in 35–60% cases. Maternal titer associated with neonatal lupus and congenital heart block, lupus anticoagulant. Antiphospholipid antibody syndrome. Antibodies involved are lupus anticoagulant, anticardiolipin antibodies. Sjogren syndrome. Antibodies involved are anti-LA antibody, anti-SSB. Anti-Rho antibody, anti-SSA. Rheumatoid arthritis. Antibodies involved are rheumatoid factor, anti-CCP, anti-cyclic citrullonated peptide. Progressive systemic sclerosis. Antibodies involved are anti-topoisomerase antibodies, SCL70. Anti-centroma antibodies, CREST syndrome. Caeliac disease. Antibodies involved are anti-transglutaminase antibodies, dermatitis herpetiformis. Anti-actin antibodies. Chronic autoimmune hepatitis. Antibodies involved are anti-smooth muscle antibodies. Liver-kidney microsomal type 1 antibody. Primary biliary cirrhosis cholangitis is diagnosed with presence of anti-mitochondrial antibodies. Myasthenia gravis. Antibodies involved are anti-acetylcholine receptor antibodies, anti-ACK, anti-MuSK, muscle-specific kinase. Lambert-Eaton myasthenic syndrome. In Lambert-Eaton myasthenic syndrome, anti-VGCC voltage-gated calcium channels plays an important role. Autoimmune neuromyotonia, Isaac syndrome, anti-VGKC voltage-gated potassium channels is the main antibody. Type 1 diabetes mellitus insulin-dependent antibodies involved are anti-glutamic acid decarboxylase anti-GAD, anti-insulin, pancreatic islet cell antibodies pica. Pernicious anemia. Antibodies involved are anti-parietal cell antibodies, anti-intrinsic factor antibodies. In small intestinal bacterial overgrowth, antivinculin is the antibody present. In pemphigus vulgaris, anti-desmogalin. And in bullous pemphigoid, anti-hemidesmosome. In Goodpasture's syndrome, anti-glomerular basement membrane antibodies, and in membranous nephropathy, antiphospholipase A2 receptor plays the major role. Paraneoplastic cerebellar degeneration are anti-WHO, anti-EO, anti-TR and anti-amphiphysin. Anti-neutrophil cytoplasmic antibodies ANCA cytoplasmic ANCA, C-ANCA, binds to proteinase 3 in neutrophils seen mainly in Wegener's granulomatosis. Perinuclear ANCA P-ANCA antibodies to myeloperoxidase seen in microscopic polyangiitis, Churg-Strauss syndrome, crescentic glomerulonephritis, Goodpasture's syndrome and Wegener's granulomatosis. See you in next session. Thank you so much.